Series in partnership with Mercy's Plum Heart Center this morning by talking with cardiology nurse practitioner Hillary Behn. Thanks for joining us.
Yes,
I'm trying to be very calm because we're going to be doing interactive here soon. We're going to be checking my blood pressure, so I need to be very calm and collected. Yes. So, high blood pressure. How prevalent is high blood pressure?
High blood pressure is actually very prevalent. Almost 50% of Americans over the age of 20 have high blood pressure.
Oh, wow. That's young.
Yes.
Okay.
Young, and a lot of those people, a quarter of those people probably don't have their blood pressure well controlled.
Okay. What are some of the signs of high blood pressure and symptoms? Because I didn't have any. So, are there signs?
Which you said earlier, blood pressure could be the silent killer. So there's not a lot of signs or symptoms of high blood pressure. In extreme cases, people could have chest pain, shortness of breath, headaches, dizziness, but a lot of times there's nothing that comes along with it.
Just when you show up to the doctor, your blood pressure might be high, or, you know.
Correct, which is why it's important to have a good relationship with your primary care provider so we can monitor these things and treat it when necessary.
Okay. Because I know a lot of times when I show up, my blood pressure, I get like the white coat syndrome and my blood pressure will be high. And as I sit there, it eventually goes down, but that's kind of how I knew that I needed to manage it because it was consistently high and it wasn't going down back into a level that maybe it should have been going into.
Right. We've never diagnosed high blood pressure off one single blood pressure. It might take a few visits to meet with your doctor to actually establish the diagnosis.
Okay. What are the dangers, though, if it does go unchecked?
Yeah, uncontrolled hypertension can lead to heart disease, heart failure, kidney disease.
Wow.
And stroke is one of the other leading risk factors for high blood pressure.
So like I said, yes, I have had high blood pressure. I've been taking, I can't say it, metoprolol.
Yes.
I can never say it for it. So we are going to actually take my blood pressure now and see how it is. Okay, so just relax, just calm. Let's think of nice calm thoughts. Yes. Okay. So here we go.
Yes.
And I shouldn't talk though probably during this, should I?
No.
No. Okay.
All right. Pump this cuff up. Your blood pressure looks great today, actually. 118/70.
Wow,
yeah.
I'm so excited.
It looks great.
Okay. That makes me really happy. So, yeah, good. So I was worried I was going to get the white coat syndrome.
No, it looks great.
Yeah. So we did talk about having high blood pressure. What are the best ways to manage high blood pressure?
So like I said earlier, close relationship with your provider to make sure that we don't go having blood pressure not recognized. Things that people can do at home to control their blood pressure, hopefully without medications, would be maintaining a healthy weight, no smoking, limiting alcohol use, and exercise regularly.
Okay. But people can have that even if they don't, you know, they aren't smokers, they don't drink a lot of alcohol, their weight is, you can still have high blood pressure. It's not.
Correct. Genetics are genetics, and we can't do anything about those, but everything we can do to prevent high blood pressure from causing other issues is why it's important.
Okay. And where can people get more information? Because this is really important, because I think a lot of people don't have symptoms and it can cause so many health issues. Where can they get more information?
There's more information on, you know, high blood pressure at mercycare.org.
Okay.
Or the American Heart Association has great resources for understanding the risks and benefits and how to treat high blood pressure.
Thank you so much for being here today. And I'm so relieved that my blood pressure was so much lower. I was worried it was going to be off the charts. Just
no, it actually was really good.
Oh, good. Okay. So I'm actually listening to my doctor and taking the medication. So I'm doing everything that I'm supposed to be doing. So listen to your doctors.
Exactly.
Listen to the people who know.